All right, that sound means that we're calling the Health and Human Services Committee of the Wayne County Commission to order. Glad to see everyone could make it and get out of their driveway today. Yeah. Madam Clerk, roll call.
Commissioner Marecki? Commissioner Dobb?
She's excused.
Commissioner Anderson?
Here.
Commissioner Baker McCormick?
Commissioner McCormick's excused.
Chair Colleen?
Yeah, I'm here. Kinda. In a matter of fashion.
You have a quorum present.
Oh, excellent. We can do business. Item B.
B, approval of the October 22nd meeting minutes.
You got to be on your toes. Pleasure of the committee.
So moved to approve.
Support.
Is there any additions, corrections, changes to the minutes? Hearing none, all in favor of the motion, please say aye. Aye. Opposed? All righty. Madam Clerk.
C, unfinished business, there is none.
Yay. Okay.
D, new business, item 1, requesting commission approval of amendment 4 to grant award with the U.S. Department of Health and Human Services, Health Resources and Services Administration to fund and operate the Wayne County Healthy Communities Comprehensive Federally Qualified Health Centers.
All righty. Someone from the department could join us on this. Give us a little update. We have 2 FQHCs, and is this our annual funding for that? Name and title, and welcome.
Brian Manning, Deputy Director. I will sit down here and croak out the information as best I can, I'm sorry. This is an annual funding. It is only for the substance use disorder portion of the overall FQHC budget. This is not the main approximately $1.9 million grant. This is basically a mix of activities that involves a relationship Wayne County Healthy Communities has with the Wayne State University Physicians Group, the psychiatric section, and also our own, staff who work at the clinic. We have an MSW as well and an outreach worker who are working as well with Hamtramck schools, et cetera.
And where are we on the rest of the funding from the feds? We're in good shape with them? Are they holding up checks? What's the deal?
Where's Kamal? We're in good shape. So
We're in good shape?
Yeah.
Okay.
What I was going to skip to is we do have a new funding cycle coming up next year. So, the county is actively kind of working on the application for the next funding cycle.
Okay.
So,
All righty, good. Questions from commissioners? Okay, questions from commissioners? Yeah, go ahead, Commissioner Anderson. I got one too. But go.
Thank you. Brian, what's the difference between the FQHC in Wayne and the one there's a facility in Inkster that I know that we're connected with in some way, right?
There's a separate grant awarded FQHC in Inkster operated by not us. Our own Western Wayne is co-located at the HAB, and we have the major dental clinic out
Right,
there,
right.
with UDM. That's kind of the major substantive difference in the service offering.
Okay, thank
yeah.
you, thank you.
You said the magic words here, University Physician Group. There's some interesting stuff going on up at Wayne State. Are they apt to be an ongoing partner as far as we know, as far as this goes?
So in talking to Tom about that, Coaches, our director, we're good. What is going on in a larger sense there is not material impactful upon our relationship with them, which candidly is pretty modest in scale, apparently.
All right, well, I had just been following it in the paper, and I thought, does the whole plug get pulled over there? I don't know, but we're good for now?
Yeah.
Okay,
yeah,
we don't know. We don't know anything more than that, but,
Yeah.
all right. We have a motion, it has been supported. Anybody else with questions? All in favor of the motion, please say aye. Aye, opposed? Are there any abstentions? All right, Madam Clerk.
Item 2, requesting commission approval of Amendment 12 to a 3-year grant award with the Senior Alliance to continue to provide congregate home-delivered and halal meals to eligible senior citizens in the 34 communities of the Western Wayne County and downriver areas for 2019.
Okay. This is just more dollars. Somebody from the department, just, yeah, if you would, please. Just remind us briefly one more time about what the relationship is between the county and the Senior Alliance as it comes to Meals on Wheels. Money moves around, who gets what money, who's paying for what?
Sure. Good afternoon, Lisa Whitmore Davis, Department Director, Senior Services. To answer your question, Commissioner Colleen, the Senior Alliance is the fiduciary of the monies that come for the Meals on Wheels grant from the feds. And we, at Wayne Community Senior Services and our volunteer and site managers execute the program, but the funding goes to the Senior Alliance and then from the Senior Alliance to us.
Yeah, just wanted, because they're the senior agency, let's see, DAAA is, what's the,
The Detroit Area Agency on Aging, then there's 1B, which is Oakland County, and then this is 1C.
yeah, Senior Alliance is also 1C
Yes.
in the federal paperwork.
Yeah.
So they have a few more dollars for us to provide meals.
Yes.
Okay.
Yep.
Questions from commissioners? Moved and supported. I'll put out mine. I'll keep on this, and I'm doing a little work myself, seeing, I guess there's a few senior agencies around the country that have somehow figured out some source of funding or gift or whatever that they can also deliver pet food to the seniors that are receiving Meals on Wheels. So I'd be delighted to work with you. I don't know if we need, some company or something to donate that or what our needs are, but I think that'd be a marvelous thing to add to the services we're doing out there, one way or another.
Well, we look forward to exploring that with you.
Yeah.
I have a meeting with you next week. I'd love to
Yes,
talk
we
to you
do. Yeah,
about that.
great.
Yes.
Any other questions? Commissioner Marecki?
I have a comment that I know there's a lot of, not, I don't know, like dog and cat places that will provide free
Yeah.
dog food. And I know Livonia's got one that'll do it for a lot of people, so.
Okay.
Because I'd be really interested in what the cost would be with this for dog food.
Yeah, and as this moves on, I'll send around an email to commissioners once we have a better idea, saying, hey, do you know somebody out there we can partner
Yeah.
with, or,
Right.
yeah. Yeah, that'd be a
you.
good thing. All right, we have a motion. Hearing no further questions. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Are there any abstentions? Thank you very much for being here today.
Thank you.
Thank you.
All right, Madam Clerk, what do we got next?
Item 3, requesting commission approval of a contract modification 28 to a contract with 3 one-year options to renew with Black Family Development to decrease funding for the third quarter adjustment.
Okay, we have, actually, these are our 5 CMOs that are providing youth services. So this is item 3, 4, 5, 6, and 7, right? And every quarter, why don't you tell us who you are and what we do every quarter here?
Good afternoon, Shanetta Coleman, Division Director for Juvenile Youth Services. You're correct, Commissioner. The quarterly adjustments, which you see before you, are happen for each of the care management organizations. It is based on actual days of care and the number of youth that they serve in a particular quarter. So what you may see before you is that in some instances, a care management organization's quarterly adjustment may be a decrease in their funding level, or you may see one that's an increase in the funding level depending on the days of care and the number of youth that they've served within that quarter.
So 3 months from now, somebody might have got a little boost based on encounter data. This time, it might be a little less next time.
That would be correct.
Yeah, okay. Questions?
I
Commissioner Anderson?
was just going to move I believe there's 7.
5 of them.
5 of
We have
them.
5 CMOs. yeah.
If it's proper to make that motion now, I'll move all 5 of them.
Yeah, you guys from Lansing know your stuff. That's a proper motion there, Commissioner. Any questions on that? Hearing none, all in favor of the motion, please say aye. Aye. Opposed? Are there any abstentions? All righty, Madam Clerk, what do we got
Thank you.
next? Huh? Commissioner Anderson moved, Commissioner Marecki seconded for all 5. Next item, Madam Chair. Madam Clerk.
Item 8, requesting commission approval of a 1-year intergovernmental.
We're on item E. That motion covered,
We're on 8.
Right.
oh, we're on 8, my bad. Yep, that's right, I went too quick. Mental Health Authority, who are those people? All right, go ahead, I'm sorry.
Item 8, requesting commission approval of a 1-year intergovernmental service provider agreement with 2 1-year options to renew with the Detroit Wayne Mental Health Authority for the delivery of mental health screenings, evaluations, treatment, and discharge planning services for jail inmate patients.
Okay, and discharge planning. Yeah, I'm sorry, Doc, I should have, didn't want you to come over here and have nothing to say. So what are we looking at? Name and title for the record?
Keith Dugo-Kensky, Correctional Healthcare Administrator for Health Human Veteran Services.
Okay, now, the county has been providing funding for some mental health services, correct?
But yes, that's correct. The item that you have before you is funding that we actually receive from.
In this case, yeah.
In this case, that's correct, to support the mental health services that we deliver in the jail.
Yeah, because the money does go both ways depending on the, how well are we, when somebody is discharged, how well are we up on the continuing services once they leave our facility? Do people have places to go? Almost like a prescription, right? Go here, this is what you need. How is that going?
Yeah, so, discharge planning is completed or started, if you will, when somebody comes into the jail mental health program. As you know, releases from jail are precipitous and unplanned, and it's difficult to go ahead and do a traditional kind of discharge plan. So when people come into the mental health program at the jail, they're discussed. Community reentry and where it is that they go takes place kind of at that time. There are some individuals that we know when it is that they're being released, where we facilitate a release either through a administrative jail release or they have a timeout. For those folks, we can do a little bit more traditional kind of warm handoff discharge planning. Everybody has the opportunity to have a paid-for 2-week prescription when they exit the jail that they can fill at any pharmacy to kind of bridge their
Pharmacy?
next appointment. That is correct.
Okay,
Any
cool.
pharmacy. Yep.
When somebody comes into the jail, they have a theoretical release date, right? Or something on the record?
No.
Oh, yeah, because I know it does vary greatly.
Right.
That they'll call you up at 3 o'clock in the afternoon and say, these are the people going to be released at 8 o'clock tonight, kind of a deal.
Yeah, so the jail has a average daily population of about 1,800. About 2/3 of that population is a pretrial population, and they can be released at any time for just about any reason. 1/3 is a sentenced population where they have an on-record out date. So the majority, 2/3, really don't have a release date that is predictable.
So that's why you do it on intake.
That's correct.
Okay. Question from Commissioner Marecki.
I have a question, and actually, Kamal, is my question, now, we're getting this money from the Mental Health Authority?
Yes, that's correct. This is money that we receive from the Mental Health Authority to support the overall cost of the mental health services that we deliver at the jail. And as you know, we deliver through WellPath.
Right, so this is $1 million more than the $5 million that we gave last year. Is this what we were talking about, Ways and Means? Yes. Okay, I thought we were giving the money to the Mental Health Authority.
No, we got additional.
We got the additional.
Name and title for the record.
Oh, sorry.
Yeah, that's all right.
Kamal Keperu, Finance Director, Management and
sir.
Budget for Health, Human and Veteran Services.
So will this 6 million then be for 2 years, and then it'll be renegotiated, or just the 1 year?
No, just
What,
this year.
what, 1
Well,
year?
last year.
Actually, for last year,
For last year, okay, all
Yes.
right. Okay, that's what I was thinking we were giving them the money. We're getting the money.
Yeah, we
So
are.
that's good stuff, okay.
yes.
Okay. And this is the most we've gotten from them in a long time, huh? Looks like?
Yeah, that is correct. Typically, the last several years, we have been receiving 5 million. This year, or last year, if you will, it's $6 million.
Okay. Sounds good.
Is that going to be based on encounter data for paying that off?
Yes, it will.
Because that's
So-
been an issue in the past,
Yep.
if we have encounter data or not.
Yeah, we do have encounter data. Actually, we've automated that process. So the $6 million is drawn down through individual encounters that we submit to the Detroit Integrated Health Network. So we get paid per encounter and per bed day, and based on those encounters, we can draw down that $6 million.
Okay, and it's working, WellPath is responsible for those numbers?
That is correct. WellPath, on our behalf, submits those encounters to the DWMHA or the DWIN.
Because we just went through an audit on WellPath. Are we in good shape in terms of WellPath being able to actually do this and our oversight at our end?
Yeah, 100%. We've worked, very hard on this. It used to be a manual data entry where each encounter would be entered manually into the MHWIN encounter system at the authority. And we have transitioned to an automated system where the encounters can be pulled right out of their electronic medical record and kind of flat filed, send over digitally. So we've improved that exchange and communication over the last year. So it's automated now, and we're in good shape in that regard.
I'm sorry, Commissioner, you had the floor.
Oh,
Go.
that's okay. I just wanted to note that in Ways and Means today, we approved a salary for someone from the county to start looking at the contracts. There's going to be 2 people, right?
One, but the other one is coming soon.
Right. I mean, eventually 2 people.
Excellent.
Yeah, so that should be on next
Excellent, because
board.
there's a lot of dollars that flow here.
Yep.
Commissioner Anderson? I'm sorry, you done, Commissioner?
Yes.
Okay, Commissioner Anderson.
The person that, or the position that Commissioner Marecki spoke of, we approved $100,000 for that position this morning, and I don't know if the other will be similar, or is there going to be different responsibilities?
The other one is more so on the finance side, and we'll look at the whole department, whereas the position that we approved today is just focused on CCS,
Okay, all right. Thank you.
WellPath.
WellPath, sorry.
It's okay.
I'll move approval of this item.
Yeah, support.
Support. And I'll just comment for the record for my colleagues here, too. There are, Medicaid dollars come to the mental health, and we should, for staff, too. We're no longer the Detroit Wayne Mental Health Authority. We're the Detroit Wayne Integrated Health Network, so we should standardize that across. I believe out of the 11 around the state, we are the only ones that send money to the jail for these services. This has been a bit of a contentious discussion that's gone on around the state. Our county's responsible or not for that. So I just want to, somebody told me maybe Oakland, do you guys know Oakland maybe sends a few dollars over there? But we are very different here in Wayne County in how mental health services are paid for, just so my colleagues are aware of that. Any other questions? We have a motion and support. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Are there any abstentions? All right, I'll stay out of it. Madam Clerk.
E, such other matters as may be properly submitted before the committee.
I believe we have some such other matters. If the director would like to join us here. I was made aware of this. It was properly submitted to us.
Oh, is that right?
Yeah, that's right.
Thank you.
So here we are. So, Mr. Brooks, what you got?
Dave Brooks, Director of Health, Human, and Veteran Services. And Carol Osterberry, Health Officer, Health Veterans and whatever.
Welcome.
Health, Human and Veteran Services. I'm
Thanks
sorry.
for being here.
Yes.
Two quick updates.
Right.
I'll let, while Carol's here, we'll do the first one. We
Okay.
wanted to just give you a quick update on the status of the lead in the drinking water issue. And then I have an introduction to make of one of the new members of our team. But I'll let Carol maybe do the quick update on
Sure.
the lead, which we talked in depth
Yeah.
about last meeting.
Right, so, we are done. I got the word from the state as far as there are no more communities in Wayne County that will have, elevated levels. Again, we distributed 11,520 filters to the 6 communities. We had just over 100 staff and volunteers. The CERT group, the Michigan Department of Health and Human Services, they even came down, our staff, and then the medical county, or the Wayne County Medical Reserve Corps. So I mean, it really was an demonstration of us bringing it all together and then also having all of those community partners. I mean, it really went very, very well, very smoothly. I think, I know from a lot of the communities, my staff was out there and they come back at the end of the day and say, wow, wow. Wayne County, you've done phenomenal. Thank you so much for being here for us. We also have been working with the state now because a lot of seniors have been asking questions. So through the Meals on Wheels program, we will be distributing 3,000 one-page fact sheets for seniors about lead in their water supply. So that's, will help us, get more word out to those maybe who couldn't even, and how can I put it? Maybe challenged to go on to websites and, find information that way. So I'm not saying all seniors are like that, but so we're just really trying to pay attention again to the comments we're getting back from those town hall meetings and who, still has more questions about all of this. Certainly, next year, as, more testing, we'll be actively involved with the state and, I've got, we're ready and geared up for it. I think that's it.
So did it end up just being, was it 6 communities?
Yes.
It still was that, because last time I think 9 communities were still out.
That's correct. So it was just Highland Park, Garden City, Harper Woods, Dearborn Heights, Melvindale, and Inkster.
Okay.
That is correct.
Thank you.
Next year's testing?
Right, then, my understanding is these 6 communities definitely all have to go through testing between January and June
Just the
of
6
next
that
year.
tested high?
Well, then I get to the point where I can only concentrate on such things. I don't know about I haven't looked at the next schedule for the other communities. I've paid more attention to these communities. So,
Okay, they were testing and sending notices based on 15 parts per billion,
that is correct.
but at some point, next year, the year after, somewhere it drops to
Yeah.
12.
2025, I believe, is
2025.
when it goes to
2025, wow, a couple of years. Do you mind sending to the commission the 6 community, just a summary, the 6
Sure.
communities, and any kind of paperwork that you're handing out there, any kind
Oh,
of flyers or
absolutely.
anything like that? So commissioners that have these communities can also be a point of getting the right information out.
Yes, and we
to
did,
folks.
right, and as
Or
every
we'll
time it
just
would
say,
happen.
call Osterberry, we'll load
Yeah.
up your phone.
No, but also our public information officer, he's here, and really, as we were getting the calls, and I think it really worked out very nicely, setting up through the Wayne County website even a separate page. Oh, I live in Melvindale, and then they clicked right there, and, we were working to make it as technologically easy as possible and very, very timely. I mean, that part worked out very, very well with Mike and Jim and the rest of the communications staff here. So, a lot of good lessons learned, plans that always were in place, and we really demonstrated them. But, yep.
Yeah, because this is going to be ongoing now. So anything you can send
Yep.
commissioners to keep them up on that, because maybe yours wasn't one of the communities this time. Maybe it will next time. So just, basic information on the lead testing program, what communities we have in Wayne County, and how are we communicating that.
Yep.
And for commissioners that have those communities, I have one, well, it was the DEQ, but now it's Eagle. The rules that have been promulgated put a great amount of unfunded mandates on local communities. So I think that's another thing for commissioners to kind of understand as they talk about this. It can be very expensive on local communities, and when it goes to 12 parts per billion, it's going to be even more. So, just so we can track the progress on this and understand it. So thank you for being here, Ms. Osterberry. Any questions on this?
I'd just like to say for the record, the amount of work was staggering. There was evenings, there were weekends, and I want to single out 3 people. Not that it wasn't a team effort, as Carol mentioned, a number of different organizations, municipal, governmental, and others, and even private sector. But Carol, as the leader of it all, Sergio De Niro, who runs our environmental, sorry.
Yeah,
our
emergency preparedness
res-
program,
Emergency
yes.
preparedness program, and Mike McElrath, who was our communications director, our information officer, really went above and beyond. So they should be recognized. And it went amazingly smoothly, if you think about it, in the firefight kind of we were in, sometimes being notified the evening before the next day's announcement and that type of thing. And to have it kind of happen as smoothly as it did, first time around is amazing. Now, this will be a cycle we'll no doubt go through now annually to some degree as other communities get tested and potentially exceed. But I think we've learned a lot, and the state has learned a lot, and there'll be some improvements, we hope, from the state as well, because, again, not everything worked as perfectly as we would have liked it to, but it went overall pretty smoothly.
Excellent. You had some other matter today, Mr. Brooks?
Yeah, I was just going to introduce thanks, Carol, you're welcome, our new Director of Clinical Services. So if you'll remember the way our department is organized, we have 6 divisions. One of those divisions is called Clinical Services, which is responsible for 4 programs. Our jail health program, Dr. Keith's as the administrator there. Our juvenile detention facility medical program, so not the day-to-day operation of the JDF, but specifically the healthcare component in the JDF, and that's Dr. Scott is the medical director and the director over that area. Our Community Corrections Program, which Ebony McCann is the director over, or administrator over, hi Ebony, over there. And our 4th program is Wayne County Healthy Communities, the FQHCs, the Federal Qualified Health Centers in Cherubim. So those 4 programs all report to our new Director of Clinical Services, Jennifer Caruso, who joined us yesterday. And she replaced Marcy Johnson, if you remember Marcy. So Jennifer now is on our team and again joined Wayne County yesterday and comes, although originally from Livonia, Michigan.
Yes.
Right?
Yes.
But spent the last, 15, 20 years or so?
24.
24 years in both City of Chicago and Cook County Health Departments and a number of other nonprofit organizations in the Chicagoland area. So
Yes.
welcome to Jennifer.
Hello, everyone. Thank you. Thank you for the welcome. Appreciate it. I'm excited to be here, and I bring with me a lot of experience in HIV disease investigation and a lot of criminal justice system experience, so really excited.
So all of it's going to fall, everything that was just,
Yep.
I haven't been exactly memorizing your internal org chart.
Well,
over the
we'll
last-
work on that
Yeah, we
later
will.
on
I
this
know, I know, I
afternoon.
know.
You can have an
Yeah, yeah.
after-school class
As you
later.
recall, I
Yes.
love when he does that. So you're going to have, like, all of the FKHCs, do you have oversight with what's going on in the jail? Do you have, so what's your relationship to WellPath then?
Well, the WellPath contract is administered by Dr. Keith.
Right.
Dr. Keith reports to Jennifer as
Okay.
part of the team, the way the structure is set up.
Yeah. 'cause
Although
there-
we all do what Dr. Keith tells us to do.
There you go.
Is he still here for me to hear?
Yes.
Well, and at some point, I think we have it cleaned up, but at some point, there was some discussion and even a letter from the ACLU with regards to HIV treatment in the jails. That goes back a couple of years. So I've been concerned about that. At some point, we'll get an update on that to make sure
Yep.
that people are getting their proper meds.
Yeah.
Kind of been an issue over there. Anything else you'd like to tell us?
No, I think that's all. I'm excited to be here. Thank you.
Well, welcome. Thank you, Mr. Brooks.
Yep.
Yep. Let's roll the agenda, Madam Clerk.
F, public comments.
Any member of the public wish to address the Health and Human Services Committee? Do I see any member of the public out there? One last time, any member of the public for public comment? Hearing none, Madam Clerk?
Adjournment.
So moved.
All right, without objection, we stand adjourned.
Did you ever see those? Simcon. I saw it.
Oh,
Hadis had one.
no.